So what are the treatment options that are currently available for treating patients with negative dysphotopsia? No financial disclosures. So this is the outline, the list of treatment options that are currently available. I would be dealing with them one by one. So doing the ND-YAC capsulotomy of the anterior nasal capsule was considered to be a treatment modality initially. The advantages are it is easy to perform, it is a non-invasive thing, does not really alter the refractive outcome of the primary surgery. However, its efficacy is questionable. Only 50% patients with opacified anterior capsule showed complete resolution. And it has never been tried in cases with relatively clear anterior peripheral limb, which we now in modern day surgery most commonly see. So the reports are of the capsules which were really thickened and sort of there was a CCC fibrosis. So I don't know really if it was the negative dysphotopsia or real constriction of the field by so much fibrosed capsule. So that's why this treatment as a treatment of this modality as a treatment of negative dysphotopsia has really not taken up. Then another strategy can be to exchange the lens with secondary lens which is placed in the sulcus. It is a very efficacious therapy, but it may compromise the wonderful result that you have already got with your primary surgery. It is difficult to perform in the late post-op period, and it is a cumbersome surgical process which with many potential complications. So most of us are not willing to go for this. The mechanism with which it helps is the same that Dr. Pakhyat was saying. It basically obliterates the space between the iris and the optic. Another possible treatment or the preventive option that can be tried is to place the haptic optic junction in such a way that it is placed inferior temporal to superior nasal. So the basic advantage it does not require any cumbersome process. However, its efficacy is doubtful. Now, one can do primary reverse optic capture in a patient who has had negative dysphotopsia in one eye. To prevent it in the other eye, one can do primary reverse optic capture. It is highly efficacious, does not involve any additional cost. However, this is also cumbersome, requires precise size and centration of axis, and almost all cases tend to develop PCO and require ND-YAC cap later. So these are the pictures of primary reverse optic capture, and you can see the formation of aftercare very early in the post-op period. Another therapeutic IOL that has been designed by Dr. Masket, it is known as Antidysphotopic IOL. It has very high efficacy, and in it basically the margin of the capsule are buried inside a groove which is made on the haptic optic junction of the lens. However, it requires femto precision to make the axis very precisely of a absolutely centered and with a absolutely precise size. So it becomes an expensive process. It is cumbersome to maneuver the anterior capsule in that groove, and it requires the change in the IOL platform. You will have to change your preference for an IOL to do this. And obviously this cannot be undone. Piggyback IOL in the sulcus is another modality which is used. It is quite efficacious, easy to perform second procedure. However, it may change the refractive status of the eye to a little extent, and it may add glare and photic phenomena due to multiple interfaces of the two IOLs. Here you can see the mechanism by which the piggyback IOL in sulcus helps. As you can see, there is a gap between the iris and the anterior IOL surface. When you put the secondary IOL, it basically fills this gap. And the symptoms of negative dysphotopsia are taken care of by basically illuminating this area. Another few conservative things which can be tried is to put myotics. Some people would be helped by mydriatics, and most conservative would be you just keep assuring the patients that it is nothing important, it will go by itself. So as we can see that as of now, we really don't have a very effective and precise modality to treat the negative dysphotopsia. And I would request Dr. Mukesh to really tell us what are the deficiencies and that he faces in his practice while dealing with patients of negative dysphotopsia. Over to you, Dr. Mukesh.